So welcome back to our fourth video in our series. So we're continuing a theme about cardiovascular disease. So last week we were talking about chest pain. This week we're talking about stroke. Next week we're going to talk about cardiac arrest management. So every year in Ireland, approximately about 10,000 people get a stroke and about 2,000 of them die. So that's more deaths from both breast cancer, prostate cancer and bowel cancer combined, which is, it's huge, guys, which transient ischemic attacks are basically mini or baby strokes. A lot of people have made reference to them over the years, and you'll hear it going on in first aid classes, or people may talk to you about what has happened themselves. So if your symptoms go away after a few minutes, you have had a TIA as a sign of a serious condition that will not go away without medical help. So 1 in 3 people that go along to have a TIA will go along to suffer a full-blown stroke within a year. So unfortunately, because TIAs clear up very quickly, many people ignore them. But by paying attention to a TIA, it can save your life. So make sure you contact your doctor straight away. So TIA, basically what happens is you could be sitting there talking away and then suddenly you get this absence for a moment. You may come out of it, you might get a bit confused or something may happen as a result of that. So ischemic strokes then are basically a blockage, and ischemic stroke are the most common type of stroke. They happen when a blood clot blocks the flow of blood and oxygen to the brain. So remember last week we talked about squeezing your finger in our cardiac video as well. So if you go along and you squeeze your video, and you can notice then straight away in your finger that it goes blue, that can happen in your brain very, very quickly as well. So we need to get the person into hospital. These blood clots are typically formed in areas where the arteries have been narrowed and blocked over time by fatty deposits known as plaque. This process is also known as arteriosclerosis. So causes then yet again are smoking. I used to smoke myself, as I mentioned in the last video. I gave them up many years ago. High blood pressure, yet again, you can go to your doctor, get yourself checked out, get a blood pressure monitor on you. And if you have to go on medication, go on, guys, don't be afraid of it. But the downside of not going on high blood pressure tablets is you could get a stroke. Obesity as well, I would kind of fall in under that bracket, but at the end of the day, I do keep myself active, get my bloods checked every so often. High cholesterol runs in families as well. Diabetes, be very careful. We'll have a video of that coming up very shortly. Excessive alcohol intake as well. So just cut back a small bit, folks, if you could. So hemorrhagic strokes. So hemorrhagic strokes, also known as cerebral hemorrhaging or intracranial hemorrhaging, are less common than ischemic strokes. They happen when a blood vessel inside the skull bursts and bleeds into and around the brain. These are very dangerous type of strokes, and they come on very quickly. The main cause of hemorrhagic stroke is high blood pressure, which can weaken the arteries in the brain and make them more likely to split or rupture. So yet again, hemorrhagic strokes, remember your blood vessel, we'll do a session on that shortly, but your blood vessels are just an ordinary pipe. It's like a pipe going across the garden. If you have the pipe turned on and you step on the hose and the next day you see this hose expanding, basically that's what happens is some of your arteries and your veins inside your head. And as a result of that, if it comes along through high blood pressure, they can actually burst. Causes being overweight, excessive amount of alcohol, smoking, lack of exercise and stress. With a hemorrhagic stroke as well, you want to be very careful that you get, a lot of people get blinding headaches with these types of strokes. So if somebody goes along and they get a pain in their head, anyone that suffers with migraines or headaches will understand this, that you have to go into a dark room, turn off the lights, make sure there's no noise. And it's that kind of a level of pain that I've come across in patients over the years. Signs of a stroke. So in men and women, sudden numbness or weakness in the face, arm or leg, especially on one side of the body. Sudden confusion, trouble speaking or difficulty understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or lack of concentration. And sudden severe headache with no known cause. And we talked about that there a second ago. So what's our assessment? So our assessment then is the F.A.S.T protocol. You've all seen this in the telly over the years. So the first thing we're looking at is the face. So we ask the person to smile. Does one side of the face droop? So if your next door neighbor rings you and they come in and you know the person, that's absolutely fine. You may be able to identify it. But make sure that you do identify it if possible and give the information to the relevant medical practitioners coming. So whether you have an ambulance or the doctor has been called, whatever your case may be, but this patient does need to go to hospital. Arms, ask the patient to raise both hands. Does one arm drift downwards? So you get them to close their eyes, put their hands out in front of them. And if one arm drifts, you need to be keeping an eye on that. speech, ask the person to repeat a simple phrase, and is the speech slurred or strange? So yet again, you as a loved one will absolutely know that. And time, if you see any of these signs, call an ambulance right away. And that's most important. We have a 4.5 hour window to help treat these patients. So we'll be going to the local hospital or your nearest care centre, but make sure you call the ambulance straight away.
Dad, will you get the brush as well?
I will, yeah. Okay, but anything else you want? No?
No, just the brush.
Okay. Be a full-time job. You're trying to do the best.
Are you okay? Are you okay? I'm gonna go call an ambulance.
So guys, after looking at our patient there outside, you notice the patient collapsed on the ground. So a gentleman of 52 years of age, I may know him. As you can see, he was at home doing a few jobs, just walking across the yard, would be a common occurrence. And next thing you notice, he collapsed. So when you're looking at him there, the first thing you notice is he went against the wall on the left side. If you notice his left leg, if you want to rewind the video, his left leg gave way. So he went down, he was holding onto the wall, which is a natural occurrence, but on further assessment, you might find that the left arm is weak. If you notice when somebody was asking, are you okay? And they went off and called an ambulance, he mightn't have been able to speak properly. So yet again, as we covered in our first videos, scene safety is most important here. So you're looking at scene safety and the scene is safe, he's outside. But if you're in around agriculture and machinery or outside and there's electricity or there's water or animals, be very careful. First thing you're going to do is assess his airway. So check his airway to make sure it is clear and patent, because if the patient got sick, there could have been vomit inside the mouth. We're talking about breathing, checking his breathing rate. You know how to do that from our first videos. Put your hand on the patient's chest and count it. So we're normally looking at 12 to 20 breaths per minute. In this particular case, the patient has got a sudden onset of something. They may feel unwell, agitated, and the breathing will get faster. When you go to check their circulation, checking their pulse, the radial pulse, because the patient is conscious. You're going along and you're going to be checking it, and we're normally looking for 60 to 100 beats a minute. In this particular case as well, is that the patients, because they're agitated, they could be slightly higher, could be up around 110, 15 beats per minute. So at this time, you would have sent somebody to call an ambulance, and if not, make sure you ring the ambulance at this moment in time. We're looking at sample history. So let's go back on our sample history. So signs and symptoms, we have a patient collapsed, asking, are they on any allergies? Are they on any medication? Past medical history, last oral intake, and events coming up to it. So that's some of the information that you can have readily at hand for the ambulance when they arrive. Our OPQRST, so the onset, provocation, anything make it worse, quality of the pain, they may experience pain. As we discussed earlier on, they may have a pain in the side of their head. The sunlight might be hurting their eyes. And if that's the case outside, give them a towel or a cloth or something and get them to put it over their eyes. That's a great little trick, and it does help them quite a bit, because the last thing you want to do is get the light to be hurting their eyes. Severity of the pain, if they have a pain or they have a weakness, and then the time and when it happened. So with all these situations, make sure that you keep calm, give the patient lots and lots of reassurance. And if you notice that the patient is outside, like leaning up against a wall and the wall was slightly wet, remember that's going to absorb the heat. The patient was sitting on a concrete ground as well. So if you could come along and get something to put in under their bum, put a blanket around them, anything you have at all, car seat covers, blankets, run into the house, get a duvet, it really doesn't matter. And you're going to wait for the ambulance to arrive at that point. So let's do a quick recap. So this evening what we did is we covered about stroke. So remember there's 3 different types we're looking for. We have the hemorrhagic stroke, which is a very life-threatening and it hits very fast. The second one then is the ischemic stroke, which is about 80% of patients, and the other one is the TIA. We're looking out for that as well. We discussed our treatment plans as well, and also guys, if you get a chance to look on the Irish Heart Foundation website, I put the link in below like I did in the last video as well. They have a lot of amazing stuff out there. So remember last year in Ireland 10,000 people got strokes and 2,000 people died from that. And the thing about it is what we're looking here is prevention and time, which is most important. Another good one too is on the assessment. Well done if you came up with the same process about your assessment after looking at the first and the second videos as well. And if you don't mind, give us a like and a subscribe. Next week's video is about cardiac arrest.